Hello and welcome, I'm Tafara Gadamu. We're witnessing a sharp increase in new COVID-19 infections in this country. How about in refugee camps? And what is being done to avert a possible outbreak, more so as we observe the World Refugee Day over the weekend? I'll be joined by the Deputy Director General of the Administration for Refugee and Returnee Affairs, Adisu Kabanesa, and Encontre, the UNHCR representative to Ethiopia. A very warm welcome to the program. Usually what you do is organize events in one of the refugee camps under one defining theme. And that is not happening this year, right? For obvious reasons.
Yes, every year on the 20th of June, UNHCR and all our partners, we celebrate World Refugee Day. This is a day that we observe to mark the courage and the resilience of persons who have been forced to flee their homes and seek safety and security in another country. And this year, it's against the backdrop of COVID-19, which means that while we would normally have physical celebrations and with refugees and the host communities, we cannot because of the COVID-19 virus, a pandemic that has forced us to live differently, to work differently, and also to celebrate differently.
How many refugees do we have in this country? Basically, the traditional refugee-generating countries, as far as Ethiopia is concerned, are what? South Sudan, Somalia, Eritrea, and also a bit from North Sudan, from Sudan proper, and so on and so forth.
We are hosting refugees from about 26 countries, but the major number is, from Eritrea, Sudan, I say South Sudan, Somalia. The number is now it's about 400,000. That means it's very close to 1 million. So we're hosting these refugees in 26 camps in the country. And some of the refugees are also living outside of camp, but the major number is just, we are hosting them in camps.
I understand that the biggest refugee camp, the largest refugee camp, hosts well over 80,000 refugees, right?
Sure, yeah.
That would be in
Gambela.
Yeah, Gambela, South Sudanese refugees. Nobody expected this to happen. Nobody expected COVID, this viral infection. We're literally trapped, don't you think?
Yes, it's really affected the whole world, and including refugees, those on the move and those who have been welcomed very generously by the government and people of Ethiopia. But it meant that we very quickly had to operate in an emergency response to reduce the spread of this pandemic. Because as you said, a camp with 80,000 people, it's not at all something that we had planned or anticipated in our plans to prevent the spread of this pandemic or the virus. We've had to very quickly redouble with our government and the health agencies or NGO partners working with us, as well as all the refugees themselves and ARA, our main government partner, to increase the water supply, to increase shelters so that we can decongest where they're living, and also all the other facilities to try to reduce the spread of the...
We'll try to talk about that later in the course of this discussion. But when was the first case reported? I think it was in the first week of this month, in June, is it? That's an Eritrean refugee, right? Can you tell us about that?
Okay. Actually, when you come to the refugees, we didn't get any formal information about the happening of the case, the refugee camps, and just on the refugees. We are just hearing this from the camps, but this confirmation should be, given by the federal government. There is a government organ which is already given with this authority just to give informations.
Within the Ministry of Health, right?
Yeah, we didn't get any information from that. So it's not possible just to say the case already happened in refugee camps and all refugees.
But did you suspect that there is some cases in the refugee camps?
Maybe, yeah. It's possible just to face such kind of problems, since the case happening all over the country. So our refugee camps are already there in the country and in between the host community. So it's mandatory to face that. That is why we are just working against the COVID pandemic.
The Ministry of Health, are they engaged? Are you sending some medical teams there to do tests and stuff like that? How is it happening? How are you organizing?
Really, when you come to that issue, we have to first, thank our government. Ethiopian government is always, welcoming government, welcoming country for refugees, especially in this very difficult time. Our government, is working, directly on refugees. The COVID preparedness and prevention plan of the country, it is also the refugee issue is already incorporated under that plan. You cannot find such a kind of generosity in other countries, by the way. So our government is working equally on refugees and host communities, because most of the tasks are they are already tasks of the government. ARA or UNHCR cannot make the test, cannot provide treatment when you come to COVID issue. It is purely the mandate of the government. So our government is already working equally with the host committee on the refugees. So they are helping us very well. By the way, they are the owner of this issue, and they are just focusing and working on refugee camps and around refugee camps. They are the one who are working on that.
You literally cannot draw a line between a refugee camp and the host community. It's very clearly overlapping, and I understand why it would be.
Yeah. And this is why, as Atu Adisu says, the government has been very generous, and all the refugees are incorporated in the national plan, the response for prevention and for responding to this virus. And this is something that has helped us a lot. So all the testing, the isolation centers, the treatment centers are managed by the government, and refugees who need to be tested or who need to be treated will be accommodated in the government facilities.
Yeah, because these are government health hospitals, basically outside the refugee camps. But I understand that you are undertaking some kind of awareness campaigns.
Immediately that the virus was announced in Ethiopia, the efforts that we undertook were to try and brainwash, if you want to call it that, because refugees are traditionally not aware of. Culturally, they eat together, they do everything together, they work together in the farms, in the agricultural endeavors that they do. They sleep together in very close proximity because of the overcrowding of some of the camps.
And much of the time they don't have anything to do. They sit down and talk as a socialized, right? That's also...
So it's a natural thing for them to be culturally together. And we started this educating them about the social distancing, the physical distancing, washing of hands regularly and all the time, in putting more water points in the camps, trucking water where the water was not enough from certain areas, and making sure that we got a level of water per person per day, on average to 15 liters for each person. And this was up from 7 and 8 liters. The normal standard is 21, but this we can't do everywhere. But we've really increased the water and hygiene facilities so that we could mitigate all the risks of the spread of this pandemic.
It's not an easy thing to do, because I've visited some of the refugee camps up in northern Ethiopia and in western Ethiopia. So it is a pretty huge task for you guys, right? I mean, it's not an easy thing.
Yes,
sure.
Yes.
Yeah, really, it's too difficult, as you said. Especially when we see most of our refugee camps, there is shortage of water, shortage of shelter, almost shortage of basic facilities, So having this all shortage, it will be difficult just to work on the prevention of the virus. But what we did is that, we already prepared a plan, as a national plan, specifically just to work on the camps, on the services that we are providing for them. UNHCR and our agency, together with different international and national non-governmental organizations who are working or humanitarian operation, we are providing these basic facilities. So what we planned is that, we need to increase, the supply of water, other infrastructures, So we have been working together and we already showed a good progress, but still a lot remains. So it's very challenging, really it's very challenging, but together with our refugees, by the way, we worked a lot on awareness raising, and most of them are really understanding the impact of the pandemic, and they are assisting even us, and they are cooperating with us with the limited resource that they are receiving. Really they are just working against, working against the pandemic. On the issue of prevention, really they are working and cooperating with us. So we are just working a lot, but a lot remains. It still is challenging, by the way.
Well, that's a very, very interesting thing to hear, because quite often, unlike settled communities as we are outside of the refugee camps tend to be, folks in refugee camps, they don't know for how long they would be in those camps. Some of them are for a few months, and plenty of them are for many, very many years, 15 plus years to 20 years. So there is a degree of hopelessness, right? Everywhere. As refugee, you are settlers, you're a nobody. Yeah. So it's very interesting to hear that you're making a difference, that refugees have hope, yes, so that they cooperate, they become part of the response that you're organizing. It's an interesting thing to hear. I mean, normally this doesn't come to mind, right?
Yes. Mm-hmm. But it is very important that they understand, and in this case, they themselves have played a major role in helping the prevention of the virus, because we have a plan that we've put together with a government agency, ARA, with WFP, the food agency of the United Nations, and then in the regions themselves, we've had to make that plan come alive. And they have played, the host communities and the refugees, a major role in really mitigating the spread of the virus.
So you have committees, yes, representing refugees that can sit down and do the conversation with you, the ARA and also UNHCR or any other agency that are supporting the works of ARA and all these refugee camps. They sit down and talk and do the conversation. So they're pretty much positive. Is that what you're telling me?
We organized the national task force at national level, which is already working specifically on refugee camps and the refugees. And we have also a regional task force inside the camp. We have also a camp-level task force. These task forces are really working very closely with the refugees, and also on the refugee camp. So what we are observing from that is that they are really very much cooperative, just to work on the plan, and really we are just showing good progress. By the way, before 1 month we have been facing a lot of problems, but now.
Like what?
When we just informed them about the pandemic and just to keep their social distancing and something like that, they were not, that much volunteer. But after we work together, after we engage on the task, really, they are just assisting themselves, advising themselves, and they are just listening to, our direction. And nowadays they are implementing most of, the preventive directions, So that is the progress that we already observed, yeah.
So I'm just trying to understand, in refugee camps like they do it here, the Ministry of Health, even at the regional level, at a community level, they undertake some kind of testing. They cover all over the places and so on, and they check our temperatures and so on and so forth. How is that managed in the refugee camps? Do you do that?
We do that, yes. One of the challenges that we had at the beginning, of course, is having access to these PPEs, the preventive equipment, the masks, the thermometers and so on. Once we got those and we put systems in place, so for the food distribution, for instance, which is usually every month, we extended that to a 2-month period so that we didn't have to have the refugees come out together, to be together, and to avoid...
I've seen those, so it could be very, very crowded.
Yes, but we've had systems where they themselves, they use a stick or a ribbon or something so that they make sure that they're a meter apart. The food distribution took longer, but it meant the conditions were more safe. and they adopted those conditions and those practices to reduce all the damage and all the mitigation of the spread of the coronavirus. So that's where the refugee committees played a big part, and the refugees themselves helped in all these measures to prevent the spread of the virus.
Yeah, just to add on what Madam says, you see, we are getting a lot of support from the Ministry of Health. Nowadays we have, these thermometers in our refugee camps, and our agency is working on the health operation. So we are just starting a door-to-door testing of the refugee, the symptom of the pandemic. So we are also, the government also started, testing, the refugees, nowadays. If you go to Gambela, Asosa, there are quarantine centers, testing centers, and refugees are, benefiting from that service. So this helps us, much, just to work on our service. So this is what we are doing now.
I'm just assuming this is not something that is based on some empirical, whatever research, but I would feel that it would be much easier to handle the coronavirus issue in refugee camps than outside of refugee camps, because you have a community of people.
Yes.
Within a certain perimeter, living there, working there, and so on, and easy to control.
You see, the other side of that is that they live in very close proximity, because the camps, the houses or the hangars or the tukuls, wherever they live, are really close together, close to the host communities, but in the camps themselves. So although it's a captive group and you can go from door to door, the other dilemma is that they are so close to each other.
And it can be very easy for the virus to spread.
Yes.
I understand.
One person gets it, you can imagine how quickly that would spread, like a bushfire almost. So the importance of hygiene, of practices of testing to see whenever somebody has the symptoms, to confirm and isolate that person, and then thereafter treat that person. So it has the downside of being in a captive place, as you said.
I understand, but one of the major issues as far as addressing this pandemic is one of the key elements in the process is contact tracing.
Yes.
And obviously, I guess that's much easier within refugee communities.
I don't know if it's easier. Refugees move around like everybody else, and the refugees, they go out to work either in the cooperatives in their agricultural fields. Some of them are aiming to be self-sufficient, so they have small businesses. So with people coming and going and the close proximity to the host communities, there is a lot of intermingling. So I wouldn't say it's easier. It really does have its challenges. But of course, any suspected case, you have to do the contact tracing and test every person that you can trace to make sure that they are positive or negative.
Yeah, for me, it becomes more serious, difficult, by the way. From the very beginning, there is a shortage of infrastructure and basic needs. For instance, in one house, refugee house, where at least the minimum, the average number is about 7 refugees, There may be families or not families, So even some of the houses, they are just hosting about 40 or 50 refugees, So there is a big shortage of housing, And also there are lots of, problems that we are just facing refugee camps. So that would be, very difficult. And also refugee camps are, they are not established far away from the society. They are established inside the society. And refugees are free to move everywhere, They are just interacting with the society. So it would be more difficult. And as we raised, refugees are, they are just working and moving and just to get some incomes, just to fill their gaps, their problems. So it's to be difficult, just to even implement all the preventive, directives in refugee camps. So that is what I can say.
We don't have the figures. Nationally, we have the figures every single day released by the Ministry of Health and that institute, who is in fact new cases, death and so on and so forth. We don't have those figures in refugee camps. We have yet to see that. But if things get worse, God forbid, would lockdown be a possibility? I'm just trying to look into the future.
Lockdown, in theory, means going into your homes and shutting the door, keeping the children inside. I think it would be extremely difficult in a refugee setting. Children are not in school these days for months now, and as Atuadisu says, some households have 7 up to 20, maybe even 30 people. It's not that they have doors and windows that they can lock down. They live outside. They eat outside. They cook outside. Lockdown would be, I think, practically impossible in a refugee setting.
Both of you have raised a few challenges that you're facing. Basically that relates to resource.
Yes.
Can we explore that a little bit?
We are facing challenges on all over the services that we are just providing to the refugees. Basically, we are providing health service, education, shelter, water. These are the main ones, On all these services, we do have a shortage. We are just delivering below the minimum standard on all the services.
After this COVID thing, or before?
Before. But after the COVID, by the way, still we didn't face any challenge because all the supporters were, collected before the COVID time. Mm-hmm. So we are delivering, the services as per the previous, practice. But after the COVID, I'm sure we'll face a big problem. As you said already, the COVID affected every activity. And refugee operations not, out of that. So it's mandatory to face, a challenge on the funding. So I think for me, the situation after COVID will be more challenging for organizations, those who are working on refugee operations. So what I need to just suggest is that, we have to think over it in advance. Because our donors are, they are collecting support from different organizations and from their government. But by this time, they couldn't do that due to the COVID. You know how it happens and how it affects all the economic activity and other activities. Mm. So I think it needs, a special attention. And really, I would like to use this opportunity just to call upon all the international community, those who are working on refugee operation, just to give attention for this issue and to think over it in advance, how we can, settle this challenge in the future. So it's obvious we are facing a challenge, but the future challenge will be, more challenging for us.
And more so, as Ethiopia is one of the few top refugee hosting countries in the world, we're going to feel it much more seriously than many other refugees. So definitely this is going to be an issue in the years ahead.
Just for instance, we estimated when we looked at the needs for COVID in Ethiopia, something like $34.5 million. We have received $3.4 million.
Wow, it's just nothing.
Yeah.
And we have spent, by reprogramming, readjusting our budgets, $7.6 million to ramp up the response and get prepared. So already you see the gap that's appearing. That's just for the response to COVID. As you mentioned, we still have to look beyond COVID, and the needs are enormous. WFP, our food agency, has already announced that they will have a gap in their pipeline in the months to come. That will affect the nutrition of refugees, and that would be another serious problem to add to the pandemic, or if we have any cases of COVID in refugee camps. However, we would like to say thank you to all our generous donors, because without them, we could not have responded the way that we've managed to so far and mitigated the risk of spreading the COVID virus in refugee settings. So we are very, very appreciative of our partners, of the UN agencies that have come together with us to respond to the needs of refugees and to help prevent the spread of the virus.
Despite the scare of COVID-19, Ethiopia still continues to host refugees, right?
Sure,
Yes.
sure, yeah. Ethiopia is just continuing hosting refugees even after the pandemic. The border is closed officially,
Yes.
but still refugees are, they are transiting through informal, way, and they are coming to the refugee camps and to Arab and to the government. Still, Ethiopia is really receiving them, even though it is illegal and informal. This shows that, our government's commitment, just in hosting refugees, and it is really a witness for our generosity, Especially by this time, no country is doing that. You see what's happening in the world. But my country is really showing her generosity and really her openness and willingness just to assist the poor and those of the peoples who are just leaving their home due to different reasons,
Atwed Isu has said it, but I would also like to really end by saying, without the generosity and the welcoming environment of Ethiopia, the government and the people of Ethiopia, we still find people coming through the porous borders every day. The numbers are swelling every day from South Sudan, from Eritrea. They're coming and they're welcomed. They're accommodated in camps. We're working with all our partners, our NGO partners, our donors, and most of all with our government partner, ARA, to help make the lives of these people who are seeking safety and security for themselves and for their children. And we really very much appreciate the efforts that are being shown to these people who have nothing.
Well, thank you very much indeed for joining me on this show, and wish you all the best as you observe the World Refugee Day over the weekend.
Thank you very much.
Thank you.
Thank you.